West Africa's Ebola outbreak has killed about 3,500 people. The virus is transmitted through direct contact with the blood or bodily fluids of an infected person. But to be able to contain it, the countries most affected, Guinea, Liberia, and Sierra Leone, need a lot more resources.
The head of the U.S. Centers for Disease Control says containment in Africa is critical to reducing risks around the world. VOA's Africa Health Chat host Linord Moudou has been covering the outbreak since it began.
I talked to Lenore and I asked her what her audience is saying about the health scare and how they and we can stay protected.
For countries to better handle the situation, I think the bottom line is the health system. If the health system is weak, it makes it very, very challenging to address it. This is one of the things, the messages that we've heard from experts. The United States, the question has been when the first case came to the United States, is the U.S. prepared? The U.S. has a very strong health system. Many African countries do not. So the chances of the disease being more fatal in these African countries are higher.
Lenore, some very striking statements here. The U.S. Centers for Disease Control says Ebola could infect more than 1 million people in Liberia and Sierra Leone by the end of January. I mean, that's a huge number. So how scared should all of us be?
Well, you know what some experts say is for those of us who are here in the United States and outside of these very, very critical areas, we don't necessarily have to be scared. We have to be prepared, whether it's you, me, or the next healthcare worker. It's all about being aware, being informed, and being prepared. But it is true that due to traveling, as we've seen a case earlier in October, we've seen someone who came from Liberia and brought Ebola here in the United States. So cases like this will, of course, make you wonder if you are at risk. But I don't think we should be necessarily scared. Yeah.
What about for people inside the region? Your program, Health Chat, goes out to people in Africa, listeners in Africa. What have they been telling you? What are their concerns? And what's your primary message to them?
Their concern mainly is for this disease to cross borders, to be out of hand, to get out of hand, given that a lot of the countries are have very limited resources and the healthcare systems are not very strong. So listeners are concerned about how much will it cost to authorities, to countries, to the international community for them to be able to contain this disease. They want to know how safe are they in their homes, in their countries, in their neighborhood. And even for those who are inside Liberia, Sierra Leone, and Guinea, the most affected countries, they are in the middle of this outbreak. They don't have a choice but to be hopeful. So we see some signs of hope and some signs of really worry.
We've heard so much about the people who have died of this disease, but not everyone who contracts it dies of it, correct?
Yes, exactly. That's the good news about Ebola, if there is such a thing, is that it's not 100% fatal, even though it can be up to 90% fatal. But there is a possibility of recovering. And you can recover if you find help, you seek help as soon as possible. That's why the health authorities are encouraging people to go to the health center as soon as you start feeling symptoms of fever. Even if you don't think that you've come in contact with Ebola, given the present situation, even if you think that you're having a little flu or malaria or anything, just go to the health center, get tested, and it's better to be given a negative diagnosis in terms of saying, no, you don't have Ebola, than not getting help.
Now, you mentioned being from Ivory Coast. How has this story affected you personally?
Well, Liberia borders Cote d'Ivoire, Guinea borders Cote d'Ivoire, so we are very much in the center.
The center of everything.
Yes,
yeah.
Most of the travels that are happening between these countries go through Cote d'Ivoire, a lot of them at least. So having family there, it's very scary, because the spread of the disease is just one passenger away, one traveler away, and you always wonder, when is this going to happen? Is this going to happen? Are there some cases there that the authorities are not reporting? Some people even feel like, whether it's in Cote d'Ivoire or other countries in the area, some people say there are cases that authorities are not reporting because they do not want to scare people away, scare investors away, and things of that nature. These are some of the rumors, but we cannot base our lives on rumors. So, but just to say that it is very scary, and we are all concerned, really all concerned.
Very scary indeed, but there are resources that can help. You can find advice on measures to protect you from Ebola on the World Health Organization's website, who.int.